We're all so busy living our lives. And then suddenly something cuts through that, something often very unexpected.
Paediatric trauma call, 15 minutes.
A 71-year-old female with 2 stab wounds to the back.
He was found to be in traumatic cardiac arrest.
I can't feel any pulses. We're at St George's Hospital in Tooting.
Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London. One of Britain's busiest A&E departments, under more pressure than ever.
So do you want to watch, darling, or do you want to look away?
This is the worst day ever.
You never know what's coming in, and you just have to be ready for anything.
Gas canisters exploded, 15% burns to hands, face.
In a world of uncertainty, we see a life-changing event.
I'm at A&E, I need her to get out of here, please.
When patients come in, something takes over.
I'll be fine. I'm going to be very fine.
A place where life,
Give me an A. Give me an A.
love,
Okay, good lad. Well done.
and loss unfold every single day.
Did you enjoy the Queen's birthday yesterday?
I watched the football.
All the patients you're about to see were treated in just one 24-hour period.
Don't worry.
We get to see people who love one another in loads of different ways.
Yes.
And I think you can give someone the best care in the world, but really what they want is to hold the hand of the person that they love and for them to tell them that they're going to be okay.
You're my hero.
Hi, this is Tom, 611. Who's that? Who's that? Oh, I need to. So, will you give me blood bleep and I'm down in resus, so will you let me know? Thank you, bye.
Dr. Tom is halfway through his 8-hour shift in A&E today.
He's tubed, airway's safe, I'm being around.
Fine, any problems, we'll yell.
I can honestly tell you that sometimes I'd like to lie in a little bit more, because I start pretty early.
That was a cardiac arrest, and there's a trauma call over there, who I'm dealing with at the moment.
It's like, I suppose, it's going for a really, really long run. Sometimes during the run, it's pretty tough, right? And maybe you don't even want to start doing it at the beginning of the run, but once you finish, you think that was pretty good. I'm glad I've got through it today.
See outside here, this is the skull, the white bit, and outside you can see some soft tissue swelling. This bruise is extending, isn't it? You see this bruise here is extending.
I was born in Japan, but grew up in South London. I've been back when I was 7 for a year at a Japanese-speaking school, and again when I was 12. So my Japanese is okay. Not brilliant, kind of stunted at a 12-year-old's Japanese.
Protomy's next, on the table. I'll just speak to Nigel, who's the reg, who said the patient's asleep.
I'm the only doctor in my immediate family.
Have you actually been swallowing any of the blood?
To be a doctor, you've got to love your job. You've got to care about the patients that you're looking after.
We have to keep him nice and warm, he's going to get really cold, yeah.
To be able to help people.
Thank you.
In the real serious situations. It's definitely something that I enjoy doing. It's definitely something that I feel privileged to be able to do as well.
St George's. Yep. 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 Thanks. Bye.
Adult priority, 8 minutes.
A 54-year-old woman is being airlifted to St George's after her and her husband were involved in a car crash in Surrey.
A head-on collision, combined speed of 90 miles an hour. Already had 1 unit of blood and 1 of plasma with HEMS.
She was found unconscious and had to be cut out of the vehicle. Doctors and paramedics gave her an emergency blood transfusion at the scene.
Code red, trauma call to A&E resus, please.
So, head's trauma to resus.
So a code red essentially means that the patient has lost blood, and even a very short amount of time without a good blood supply to the brain can be kind of catastrophic.
Her husband is also on his way to St George's by ambulance. Their daughter had just left them before the accident happened.
We're in town having lunch. My parents, my brother. And they went off home and we went off home. Got the kids out of the car. And we got a phone call from my brother. And just said, we've been in an accident, you need to come. We just got the kids in the car and left straight away.
Could I put another adult trauma call out, please, to A&E resus, and could I activate helipad as well, please?
We got there. It was worse than we were expecting, a lot worse. There was loads of police, ambulances. We ran over and we got pushed back because they were trying to cut my mum out of the car. I was scared, really scared. Because I'd never seen my mum like that. I didn't know what to think, I didn't know what to do. I felt helpless. It was awful. She wasn't in a good way at all.
Water to resus, please, for the code red trauma call.
The risk at 90 miles an hour, potentially the internal organs are travelling at that speed as well and suddenly stop. And internal injury or internal bleed can be very dangerous.
Ready, brace and lift. This is Michelle. Michelle was the passenger in an MPV which had a head-on collision with a car. Both cars travelling approximately 40 to 50 miles per hour. Injuries top to toe. Essentially, she's got bilateral rib fractures, the most pronounced on the right-hand side. She's got some right upper quadrant pain, period liver injury. She has a pelvic binder in situ. She's had 1 unit of blood and there is some plasma that's on her there. She dropped her systolic while she was still trapped to about 75.
Michelle? Michelle? Michelle, my name's Tom. I'm one of the doctors. Can you hear me? Okay, on brace, ready, set, brace. Michelle? Do you know where you are? You're at St George's Hospital in Tooting. Is that painful?
Definitely right side. I think it has reduced the lymph in both sides.
If you have an injury to your ribs and your spleen and your liver, potentially all of those together can cause a lot of bleeding and can make the patient's conditioning critical or life-threatening.
Let's get a scan done quick, guys. There might be something in the chest. Michelle, on slide, ready, set, slide. Fantastic.
Sorry, number.
It's been just over 20 minutes since Michelle arrived in A&E after being involved in a head-on collision at a combined speed of 90 miles an hour.
Keep breathing for us, OK? Keep taking nice breaths.
She's been given an emergency blood transfusion to stabilise her blood pressure and brought to CT to scan for injuries to her head, neck and internal organs.
So we do head to pelvis, yeah? Head to pelvis.
Growing up with 4 other siblings, Dad was always working and Mum has always been there for us. She wasn't a strict mum. No, she was quite a laid-back and chilled-out mum.
Breathe in and hold your breath.
Me and Mum used to go swimming, just me and Mum, and go on bike rides. And that was nice, just time with me and Mum. Mum would make sausage casserole. I used to love that. I still try and make it now for my kids, but it never turns out as good as Mum's.
RTC passenger, head-on collision, likely pelvis, bilateral rib. Head appears to be OK, but she's had some ketamine before she got it, so we can't really tell.
She was just there for me when I needed her.
Michelle, big deep breaths in and out for me. Yeah, we need to take her around, because I'm a bit worried about her sats.
Doctors must now wait for the full results of the CT scan in order to prioritise the next stage of her treatment.
My mum says she'll pay for my eggs to be frozen at 30. She also, on my last birthday, we've got this shelf where we keep like all the nice pottery and stuff at home, and she cleared a little space on it and sent me a picture saying, just for you, little space on the shelf.
Did you bring a charger for my phone or not? Just
No, I'm not in charge of charging you.
Tom. The entire reason we're here, and you just keep lolling on it.
No, that was not on your hand, was it? Oh, it's very bruised, isn't it?
There you go.
Oh, blimey. I've got so much support around it, but it's still... Oh, God.
73-year-old Monica has come to A&E with chronic hip and leg pain. She's accompanied by her son, Elston.
I'm not quite sure how you're going to get on top of this.
Listen, I'm agile as a monkey.
So, Monica, tell me, what's brought you to hospital today?
I have this pain in here.
Okay, so you've had this pain since?
2 weeks. 2 weeks. What?
I would say probably like the last 3 weeks.
Once it starts, it is murdered.
That's right,
Okay.
but it's normally seasonal, but...
Well, what I'll also do is I'm going to just move this bed this side.
Yes.
And probably I'll just have a feel of your joint, if that's all right.
Okay.
Yeah?
I have to slim down. I've put on weight again. I grew up in such a beautiful house in Trinidad. Trinidad was nice, but people were very, very poor.
I'm just going to move this head and down, okay?
I grew up where we put on a plain dress, you go to church. I used to go and read the Bible, stand up.
Can you feel my fingers?
Yes.
Can you feel my fingers?
Yes.
What I need you to do is try and raise this leg.
I wanted to be a nun. To be a nun, you have to travel.
Is this the place where you have the pain?
Oh, I think just now.
Just now you have it?
Yes.
That hurts you? Okay.
I came on the TN Venezuela to London because the plane didn't start until 2 years after, 63. 2 weeks, the longest journey in my life. I vomit every day. I couldn't eat. Oh, God.
What I need you to do, okay,
How
if
are
you
you
just turn
feeling?
onto your left
You're
side.
struggling.
Yeah.
I came in September, and boy, wasn't it cold. And everybody's saying it's hot, and I was freezing. It's freezing, yes. And my friend took me around to see places. So nice. Somehow it's so nice and different. I'm not used to that, but I adapted. I adapted.
Because I could tell you're struggling by turning around the bed.
Have you got any pain around here?
No, but that's where the pain started first.
Okay. Monica, would you be all right if we just took some blood samples today?
Doctor, I am easygoing. Even if you kick me, I'll turn the other way. I'm easygoing.
Okay. No worries. We'll just take some blood samples, yeah? And then we'll see if there is anything acute in that, which might also be one of the reasons why you're having so much of pain. So I'm going to come back to you.
Yeah. Thank you.
Can't walk. You really seen you walking there. You couldn't walk.
You can change
just
it.
Boring.
I like that. That's nice.
Just the two choices. Hello, St George's ED. Okay, go ahead. Echo Juliet. Thank you. Bye.
Adult male, trauma call, 5 minutes.
A 41-year-old man is being rushed to A&E with a severe ankle dislocation.
Dislocation of ankle. It's critical skin.
Hello?
5.
Particularly term the critical skin, it suggests that the skin's blood supply is being breached. If you don't restart the blood supply to the foot, then the risk is that the foot may die or you may have more permanent long-term injury.
The man was at a trampolining centre with his 12-year-old daughter when the accident happened.
We had 10 minutes left and I was facing the opposite way.
and he shouted over to me and went, Maisie, I've broken my ankle. And I turned around, that's when he had his hand over his foot. It was changing colour, it was shaking, and you could see like his bone. He was just laying there and he wouldn't let no one see his foot, so he asked people to cover it up for him.
It's all good. Just be gentle.
Okay, on 3, 1, 2, 3.
So this is Darren. He was on the trampolines. He's bounced, landing onto his right ankle. Query, right ankle fracture / dislocation. He's complaining of pins and needles. He's had 10 of morphine and Entonox, still complaining of quite significant pain.
Oh, it's just really aching now.
I'm not surprised.
Yes, no problem, love.
Is there anyone that we need to call for you?
They're outside, they're right.
Just outside.
I was with my youngest, and now my eldest
How
has
old
turned
are
up.
they, darling?
Oh, here we go. 12,
Yeah.
20, 25, and 26. It's a really good day out. Is it? Yeah. But you've got all
I'll
that...
follow in your footsteps without the braking bit.
I always like to take them out, just to keep them entertained all the time, do you know what I mean? Monkey World, you name it, I will do it. Paintballing, bungee jumping, you name it, I'll do it. Do you have any allergies? No, mate. The only thing, I'm allergic to penicillin.
And you normally fit in well, yeah?
Yeah.
And no asthma?
No.
Any missing teeth?
No, yeah. One there.
Is anything loose?
No, well, take the light. This one's started to go loose now.
Oh, yeah, OK. So what we're going to do is give you some medicine through here,
Yeah.
which will make you forget everything that happened. It's called ketamine and a bit of midazolam, so we can reduce your ankle and put it back in a normal alignment.
So you're going to snap it back?
We are.
OK, no problem.
The dislocation is time critical. If you don't restart the blood supply to the foot, the worst case scenario is that they're permanently damaged. And then very, very last end of the line might be some kind of amputation.
Pat made a nice one the other day.
Pat made a cup of tea?
Yeah, it was really nice.
Oh, my God.
She's really
Do you know
good
what?
at making
It's very rare that I get a cup of tea made for me.
I've lived in London all my life. I don't want to move out. No. Well, they won't get so much, you see, my sons. I take an annuity. I think they're only going to blow it on a Maserati or something. Hope I haven't. There's an opera frock in there that's worth a few thousand.
Michelle, I'm going to give you a special device where you press the button, OK, and it releases some pain relief into your veins. OK, how's that
Doctors are awaiting the results of Michelle's CT scan. They suspect she has internal bleeding and may have life-changing injuries after being involved in a car crash earlier today.
We'll take good care of you, all right?
OK.
OK?
Thank you.
Her daughter Tony has arrived at St George's.
She was in a lot of pain from her ribs and her hips as well, OK, and we were concerned that she might have broken her pelvis and broken some of her ribs. Having been brought to hospital, her blood pressure was low, so we had to give her a little bit of blood because we thought she may have bled from somewhere as well. And we've now sent her through the scanner, so to have a look at all of her other injuries as well. So she's got the blocks in at the moment to keep her head still. Just wanted to make sure until we've got the official report back from the scan. Yeah. OK, but we'll keep you posted, Tony, all right?
Thank you.
Michelle's husband Paul is being treated in the resus department in a separate bay.
Ma'am?
Oh, I was going to die. Oh, Dad.
Dad's gone up to have a CT scan. I don't know what I'd do without my mum. You know your family always be by you no matter what you choose to do. I've always wanted to be a mum, so I knew that from quite a young age. I was round my mum's friend's house, Lisa. I was round her house, and I'd done the test at her house, so she was the first one to know. And then Lisa texted my mum saying, "Hello, Nanny." And my mum rang up and was a bit, "What?" They were happy, scared for me, because I was still so young. I was 16. It was scary. I would get judged by people because they were all sitting there GCSEs and going on to work and college, and I was having a baby. That was hard. People that I thought were my friends had stuff to say behind my back about the situation. That wasn't nice. Especially when I had the baby, all of my friends sort of disowned me because I couldn't do what they would want to do because I had a baby. And she understood what I was going through. And she was there when I had Tia. And then I still lived at home, so she was there after. She just lifted my spirits. But I knew that things were changing for Mum.
I think everything you do at any point in your life will affect how you live the rest of it. When I was at school, I wanted to join the RAF and be a pilot, and was in the air cadets and all that kind of stuff. But when I was 15, one of my best friends, he was unwell at a friend's house on a Wednesday afternoon. I remember him kind of lying on the sofa, not being his usual self, you know, but assuming that it was going to be like a cold or a flu or something. He was brought to St George's and was brought to the intensive care unit for children here and unfortunately died from meningitis. So that was a pretty tough one to take, so it was really quick as well, unfortunately, so a big shock to the system.
Whenever your mum feels pain, she presses that grey button there and releases some morphine.
That was an extra trigger to get into medical school.
What you want to try and do is get your mum to be able to breathe nice and comfortably, that's the most important.
Yeah.
Orthopaedic doctors have been called to resus to assess Michelle's injuries.
Can't move properly without you hurting.
We'll have a little feel around the back. Just let us know if there's any tenderness at all.
Is that painful?
Does it hurt in your tummy when you cough or your chest?
Yeah.
That's where your liver is. The injury to the liver, stretching.
Oh.
Doctors are concerned that the impact of the collision may have fractured Michelle's ribs and punctured her internal organs, so need to carry out further investigations.
We're going to give some ketamine to midazolam. Take him off the, let's take him off the scoop.
His legs still.
It's been 17 minutes since Darren arrived in A&E after dislocating his ankle whilst trampolining.
So what we're going to do is just give you a little bit of medicine called ketamine, which will make you feel a bit lightheaded and reduce any anxiety.
Doctors need to relocate his ankle to restart the blood supply and reduce the risk of long-term damage to the nerves and blood vessels in his foot.
What do you do for a living?
This is going to sound good. I'm a relocation specialist. Basically, I work for a removal company. I wanted to be a long-distance lorry driver when I was younger. I never wanted to be a fireman, a policeman or anything. No, I never wanted anything. I'm more of an outdoor person. I was, what would you say, an average street kid. Hello, love.
Hello.
Chasing the girls all over the shop. We would run down the park, rip a tree apart and make a tree house. Most of my friends, we always not tried to get in trouble so much, but it did happen every now and then.
It just feels like everything, like the muscles are just starting to contract on themselves.
Exactly. The body's trying to protect itself by going into spasm. Ketamine is a very powerful anaesthetic drug. You can sometimes feel that you're having an out-of-body experience.
Well.
From the outside, it may seem that you're quite spaced out.
You're all right. You're doing really, really well. Nice. Keep your eyes open for me.
All right?
Wow. What's that?
I was always the one on the outside.
Wow.
But I always used to get dragged into it.
I feel like all the little PlayStation games. This is amazing.
I was about 16, 17. My mum was away for 2 weeks in Clacton, and the group of friends that I ended up hanging around with, obviously, when I got a little bit older, they were a bit more of a lively lot. One of them had a moped, riding it around, run out of petrol, so he decided to go to the petrol station, bought himself £2.50 worth of petrol in the petrol can, brought it back to the house.
Great, that's working.
You're going to gently pull your leg, all right?
Yeah. They had something in their hand they shouldn't have had in their hand. One of the fellas lit a lighter, and woof, up it went. It went up in his face, he jumped up, it just guzzled out the petrol can round the living room floor.
Nice deep breaths. Keep taking his breaths.
One of my friends threw the water on the fire and it just exploded, and it took the whole back of the house out, it went through the ceiling, it gutted the whole house completely.
There we are. Brilliant. Well done.
Mum was fine with me. She came back. She knew it was the boys that I hanged around with, and then they came round to see if everything's all right, and Mum attacked them outside the house. So one of them ended up with a broken nose, and the other one ended up with an umbrella around his head.
Do we order an X-ray?
Oh, I haven't done it yet.
Oh, I'll do it now.
Oh, thank you.
My mum was very cool, very, very cool. My mum would go out and have a party with you, she'd dance with you and everything.
Nice deep breaths.
Look at how my thighs are getting big.
Okay.
No exercise.
Don't be training for that 5K.
Monica has come to A&E with her son Elston. She has severe pain in her hip and leg.
It's coming back. I thought I'd be able to walk out. I thought I'd be able to walk out.
Doctors have ordered bloods to be taken to see if there is a serious underlying cause for her pain.
Hello. I've got difficult veins. So I have to start apologising.
No, you don't.
Veins is so difficult. I remember I had an emergency operation and the anaesthetist came out and she said to me, always when you come into the hospital, warm up your hands, warm up your hands. And I said, I want to be cremated because I'm always cold, so I want to feel some heat.
Oh, my goodness me!
You learned a few things from my mum today.
My goodness. When I came here to live, the hospitals wanted nurses. I used to work here.
Oh, right.
When I was young, I'm 73 now. I went to George's as an agency, and I got the agency job. I love nursing, looking after people. Oh my God.
Right, I've found a vein. So, let's see.
Good luck, darling. Oh, gosh. It taught me to be kind, because taxis those days were very expensive. Patients going home, they have no money. And I will go and give them. They say, I'll bring it back. I said, no, don't.
We've got it.
My goodness me.
Yeah.
She deserves an award.
Now, every time you go and get a blood test, you have to think of her name.
You have to ask for me, yeah?
My goodness. All the nurses used to go to the pubs up here. We used to go here, and their pubs, they know it was the nurses' pubs. When we come, all the chairs were out. Jeez, look at that. We used to go dancing. Gay clubs, listen, we love the gay clubs, and I love the gay men because they are great fun.
Well done. I've got 3 full bottles as well.
My God.
So the vampire doesn't have to come tonight.
Yeah. I used to say to my husband, Noel, can't we swap hands? Because his veins was beautiful. Before I met Noel, I've been married twice before. He heard I was divorced, so he came in, knocked the door, and when he walked in, he had denim, and he had the denim jacket. Oh, and I said to him, oh, God, you look sexy. I'm sure he was blushing. And he said, we are going out, so I dress up in heels. I can't walk in heels. He was tall, very intelligent man. Then, a month after, he said, Monica, I'll come here and look after you for the children. Noel was more than a father, especially Elston. Elston wasn't good at maths and things. He would teach him. Which one are you reading?
Thriller, crime thriller.
Oh, Billy.
It's good. I've probably read about 4.
I think Noel and I, we started going out. And my God, that's when the racism started with them. We had it from both sides. People used to stop in cars. Why are you with a black woman? These 3 white men, they came out of the crematorium and they said, have you got a light? Noel said, run. I said, I'm not running, I'm going to kill them. And I think they heard and they left us. When we had it at the pub, I decided, I think it's best we break up because I can't take any more, you know. Noel said, Monica, just ignore it. Just ignore it, he said. I asked him to marry me after 7 years. We married for 28, but we were together for 30-something years. I can't explain to anybody this pain.
Don't worry.
Doctors need to wait for Monica's blood test results to decide on the next stage of her treatment.
She crashed, combined speed of 90 miles an hour, was at code red with them. She's got the total ability to drop her blood pressure again and bleed again.
Michelle's sons have arrived in A&E. Doctors have received the initial results of her CT scan. They show multiple injuries to her internal organs.
Found that she's got some rib fractures on the right-hand side. If you've injured the liver, probably the ribs above it will be injured as well. She's also got a bruise on the spleen on the other side of the abdomen. So all of that really means she needs to be observed closely by our surgical team if there's any delayed bleeding from the liver. And that may develop over the next 24 or 48 hours.
Alright. I'm alright when I'm laying still.
You seen the car?
No.
This is you, man.
Yeah. I just remember all the noise.
You have to tell them they are your meds and tell them that you are up to time on them.
It weren't until we got a bit older that they started opening up a bit more about the illness. She wouldn't do half the stuff that she would before. She's got depression, anxiety, split personality disorder. It was like we'd lost a part of her. My dad sort of jumped into my mum's role. He gave up everything to be mum's full-time carer.
Alright.
How'd you feel?
Bad.
We've been together for 40 years.
I'll see you tomorrow.
Because Michelle was so up and about. And then all of a sudden, after that day, she just gradually went downhill. That's when I knew I should stop work and look after her. No hesitation at all. I went into work that following morning and I said, no. Give my notice in.
Take care. Alright, and night.
I care for Michelle, full time. Because sometimes it can last for a month at a time. All I can describe it as is parasite in the brain.
What's that been like for you?
I suppose it's fulfilling, really. It is. To know that I can do it for her.
Yeah, 1 rib fracture on the right.
I think so.
Michelle will be taken to intensive care, where doctors will continue to monitor the bleed on her liver and damage to her spleen.
Thank you.
Thank you.
How old are you? 42, man, yes? You
guys bringing us that?
Yeah, man. It's only a number to me. Only a number.
Of course.
You're as young as you feel, man.
Doctors are awaiting the results of Darren's X-ray after having his ankle realigned. They are concerned that the dislocation may have caused permanent damage to the muscles and nerves in his foot.
Hey, how long have you been here? 5 6 years now. Wow.
Last count.
His stepdaughter Billy and daughter Macy have come to see him.
I've proper snapped my ankle, love.
Oh my God.
And it literally went sideways. I've got like a bandage thing around it at the moment, do you know what I mean? It's like a solid concrete thing that runs from the bottom of your foot up the back of your leg, and then it's wrapped with a bit of foam and then a bit of bandage. All right, I'll speak to you soon. Ta-da.
Very close to my mum. We used to love sitting down doing, I can't remember what it's called now. It's not knitting. Was it crochet? I think it is crochet. Because you used to do the little round crochet things with the little puppies on and things like that. I used to sit there. It used to amuse me. I used to get, what's the word for it? It used to be therapeutic.
Darren?
Hello.
Hello, nice to meet you. My name's Charlie.
Hello, Charlie.
We'll just do your blood pressure again in a few minutes,
Yeah, it's
okay?
fine, yeah.
You feeling okay?
Yeah, I'm fine. I'm all good.
Woken up?
Yeah, I'm there. Just want to get up, want to walk about.
My mum was ill for a long time. She was on a dialysis machine for months. The heart started getting weaker, her breathing started getting weaker, and then you could see she was deteriorating day by day by day.
Want to sit up a bit?
Oh, yes, please.
It got to the point where they said, if we do any surgery on her heart's so weak that at the end of the day she might not come back round. And my mum automatically said, if I go, just let me go. Don't try and bring me back, because I don't want to come back, do you know what I mean? Because I'm just going to be sitting there doing nothing.
Do you want us to go and get you something to eat and drink?
Can I have a drink, please?
She said to me that night, she said, it's going to be soon, son. That's the only thing that I always stuck in the back of my brain. Got a phone call in the morning from my sister that I knew straight away something was wrong.
Oh, wow.
She was talking to me in that before, and then the next morning, nothing. So it was, in that kind of thing, it was really, really hard.
I just landed once and it just went wrong.
But you was rolling around, which made me scared.
Very hard for Macy at the time as well, because she was quite close to my mum. So, and in fact, actually telling her when she come back, that was the hard part for me. Is actually sitting down in a room with her and actually telling her at the end of the day her nan's gone. So it was quite hard, very hard. But I dealt with it. I got on with it. My mum meant the world to me.
How you doing, you all right?
I've seen your x-rays. They look absolutely fine. The reduction's perfect.
Got on.
Now, what has dislocated is not the actual ankle, it's the subtalar joint. Sometimes when it's dislocating, take some bony fragments.
Yeah, it can make it a bit more weaker.
They can trap inside.
Okay, fair enough.
So we need to assess the condition of the joint. We need to take another exam. We need to get you through the CT scanner. I want to be completely clear that there's a chance of that swelling up.
Yeah.
And you might develop what we call compartment syndrome, which is a devastating complication, all right?
Yeah.
It might lead to necrosis of your foot. We're going to keep him in overnight anyway.
Oh, don't do hospitals overnight, mate. Trust me, I can't stay in
I
it.
think that it's a good idea to monitor this leg of yours because the actual joint has been out for at least 2 hours. We just need to get this scan, all right?
Oh, he goes fast. It's like the fun fair. It's the fun fair.
Laundrette, 14th of the 6th. Oh, that's when I went to the laundrette. 14th of the 6th, 16. Up at A&E.
Retired nurse Monica came to A&E earlier today with her son Elston. Doctors are still trying to work out the cause of her hip and leg pain.
I found it, Charles. I found Charles. Remember?
You found Charles de Gaulle. That's the airport, isn't it?
One thing with Noel, oh, I enjoyed my life. He'd take me on holidays and things, and because I've never been on holidays. He was my life. He was everything.
You know, the last word is the hardest to get. S-A-Y-S.
7 years he died now, so... But I miss his intelligence.
Found it.
Doctors have received Monica's blood test results.
So we've had a look into your blood results. I don't think that there is something which you should be worried about in terms of an infection. And what we are planning for you is to go to the CDU in terms of how, and of course, how you mobilize yourself. And they will also have a discussion about how you're going to manage things back home and if they can help you with that. We are just worried about you falling and hitting your head.
Yeah.
Oh no, I've got
Anything
sticks.
could happen, Mum, listen to him.
So let them have a look at you, and they'll give you a choice, and then you should be able to make the decision. That's not something we're going to decide right away.
Yes,
That's the best thing.
Okay?
What has life taught you?
to be kind. Doesn't matter what they do to you, be kind. And if you find somebody who loves you, my God, it's really good, you know?
It's all changed. Jesus, Lord.
Monica will now go to the clinical decision unit for further assessment.
Hello, mate.
So I'll take you for a CT scan, all right?
Oh, now, already?
Yeah.
Time waits for no man.
Doctors need to scan Darren's ankle to see if the dislocation has caused any disruption to the blood supply that would put his foot at risk.
When my nan died, he was there to help me. We're very close. I know a few of my friends' dads and they're not that fun. They wouldn't go out and do what my dad does.
Yeah, sorry, Chris.
Cheers, Charlie.
Yeah, I have a reminder on my phone to ring him at 7 o'clock every day to know how his day's been.
Oh, do you want to go and sit back in the room now? I'll be back in a minute. I'm just going to have my scan, but I didn't want to leave all the stuff in the room. I've pulled the curtain closed. I'll be back in a sec.
After my mum passed away, it was a bit hard for me at the time. I did lock myself away for a little while, so just like keep myself in the room. I didn't want to know no one.
Oh. Hello? Well, I'm just going for my scan.
And after a while, it took me a couple of weeks to get round to used to the idea, and then just come out and just went back to my normal self. And then just always remembered at the end of the day, it's always in the back of my head. Do you know what I mean? The memories that I need to have are up here.
Right, we're going to do this scan of your ankle, OK?
Yep.
Darren will be kept under observation until doctors have the full CT scan results and can rule out any long-term damage to his foot.
Are you happy if I stand down? Yeah, thank you. When you've had a loss, you learn to appreciate things, your time that you have, and you know, you realise suddenly that they're not always going to be there. Their family is really important. You know, life's pretty tough, so you need all the people around you that love you to support you through that, to also enjoy the things that you enjoy as well, and to kind of appreciate things. And everything's much better to, you know, everything positive in your life is so much better to do it when you're sharing it with someone or people than doing it by yourself. That's why Christmas is always better than birthdays.
Elaine?
Oh my God,
You remember
yes,
Elaine?
Yes, I remember the face, if nothing else.
Yeah. Monica. I always remember you doing nights.
Yeah.
Always chatting up the fellas, she was.
Have you got anything else in life that you'd like to achieve?
To dance again. But I'm not going to flirt I'll go to the gay clubs to tell you. I don't want to go to the straight club.
All right, love, what are you trying to do? Take me off the road or something? Trying to do me over even more, ain't you, bruv, eh?
look on the negative side. I always look on the bright side. I always look at the bright side of life, always. Just get on, just enjoy your life while you can, basically. Do you know what I mean?
I was there every day. I think the whole time she was there, I missed 1 or 2 days. It meant a lot to her. So she has been strong through this, and now she's coming out the other side. We keep saying that we're going to start swimming again. We will.
Michelle means the world to me. She's just everything I've got.
He's always there for me. He always has been there for me. And I think he'll always be there for me.
So I've got you into a hassle.
Into a hassle?
A fox.
Your heart rate's gone up.
Well,
I told you.
ever since you came in.
St George's. Adult male trauma call in 8 minutes.
The whole road was cordoned off. There was, 2 ambulances, and then you just see him lying there. You fear the worst at that point.
Sometimes, even with the best care in the world, we can never get people back to the point where they can live the life that they lived before.